I have to say, just on this one note, my heart sank yesterday when I realised that the COVID inquiry was asking people to take a lateral flow COVID test before attending. Once a week if you're a regular attendee, and before you attend if you're just coming for a day. This feels like a blast from the past, but does this tell us quite a lot about the attitude of the chair of this inquiry and her staff?
I think you're completely right to be concerned about this issue of asking people to take a lateral flow test. You don't have to do this if you went into the courts of law today. You don't have to do this in the House of the Parliament, and you certainly don't have to do it in TalkTV. But what it means is you've made an a priori assumption about lateral flow tests, that they can correctly identify active cases, they can identify infectious people, and that they actually prevent transmission in some way. Once you made them assumptions, then what's the purpose of an inquiry? Because you're basically supposed to be there with an open mind, asking questions about whether the £37 billion we spent on testing and test and trace programs actually was worth it in any way. And you start from this position. I have a position here. If this was a court case, you would be concerned that somehow the witnesses have been tampered with, or the evidence has already had assumptions, and therefore this needs to be really thought through. Who made this decision? On what basis? Because if you've got these assumptions up front, you really are not worth having an inquiry.
No, indeed, and it's interesting. We've had the usual suspects all out and about in advance. You know, the John Edmonds on stage and people like that. And we know that one of the main thrusts, certainly of the media, which at the time, back in February, March 2020, were to go lockdown, 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 and then lockdown harder, lockdown stricter, and then the argument was, don't come out of lockdown. Why aren't we locked down again? And now, of course, they're all going, isn't it absolutely terrible, these NHS waiting lists, and isn't the economy in an awful state, and why are all these people dying of cancer? This is an outrage. Why are all these children having mental health problems, and why don't they know anything? Why have we dumbed down all education? And you go through all of these things, and people like you and me, your colleague at Sunetra Gupta, Alison Pearson at The Telegraph, Molly Kingsley, Us for Them, Laura Dodsworth, author, and so many other people, Carol Sikora, the cancer specialist, we were going, this is crazy. Now, I wasn't doing it from word go. I was supporting lockdown early on. I never thought it should be sooner. I never wanted the schools shut down. But early on, I'm like, OK, I'll believe the evidence. The scientists, the Chris Whitties, the Patrick Valences, they know what they're doing. I'm not an epidemiologist. They must be right. But the reality is, we know now, from the Hancock WhatsApps, which my hero of a colleague, Isabel Oakeshott, managed to put into the public domain, they didn't know what they were doing, did they?
No, and I think this is an important issue, because I think what's going to happen in this inquiry, it's going to be a real David and Goliath moment, where all of those people in Sage supporting the lockdown are going to have a huge presence in the inquiry. And as I understand it, there's only going to be a few people. I've been invited myself in Module 2, and I'm not sure if they're going to want me to turn up, but I've given evidence.
Will you be taking a lateral flow test first?
No, I will not. I will be asking simple questions like, can you explain to me very clearly what's the definition of a case of COVID? Can you explain certain features, like how you're going to underpin causation? But I wanted to just make a point. The Chilcot inquiry took 129 witnesses. It took about 18 months. Finished the inquiry for taking evidence in 2011. Published in 2016, 2.6 million words, 12 volumes. This is taking 3 times as many, and says it might have more witnesses going forward. So it's going to be 3 years plus before we ever get anywhere with this inquiry.
Oh, we've told we're easily going to be in 2028, 2029 before we learn anything. And the big worry here is, look, even some of the questions we understand they've been leaked, that the Baroness Hallett, the chair of the inquiry, has sent to Boris Johnson. And again, who leaked those? Who knows? I couldn't possibly imagine. Questions like, did you consider, sacking Matt Hancock? As if this is remotely relevant to the big issue. Because it seems to me, and we spoke to John Redwood about this earlier, the key questions that weren't asked, and something that a lot of the Tory MPs who were considered to be, the COVID deniers like you and me, but people simply just asking for basic, normal political debate and economic debate to happen, and medical debate, because we used to have that in science and medicine. What evidence is there, or was there, for each policy? As each policy decision was made, what evidence was there? Because we know the locking down, the evidence for that evidence was basically a computer model proven to be useless from Professor Neil Ferguson at Imperial College. In every single model he'd ever done on any other disease had also proved to be wildly out, but also a cost-benefit analysis of the impact of each policy. And as we've seen, Department for Education, we finally got them to publish their evidence for children being told to mask in classrooms all day. When they produced their evidence, the evidence they actually produced was actually a study which showed there was no benefit to children wearing masks, and in fact there were large downsides. So much of what they did was just sort of plucked out of thin air, just randomly chosen. Oh, this'll sound good. The media and the public might like this. But no one wants to face up to that. Not the politicians, not the scientists involved, not the media who didn't ask the right questions, and not the public who were all duped.
Yeah, so look, you're talking about the 200 plus policy changes in 2020 alone. You want to take each one of them and start asking questions, forensically asking what was the evidence that were made on, who made the decision, and then work out which ones were worked or not, as is the case. You talked about asking for the lateral flow test. If you follow the logic through, what's to stop them when you're getting there saying, well, actually, there's a rule of 6 in here today, or there's 2 metre distance in, or we've got these plastic shields up. You basically need to come out of this inquiry going, where is there a solid evidence base for intervention so that in the future, the idea that you're asking questions about sacking Matt Hancock is immaterial and superfluous to addressing the main issues. So I'm in agreement with John Redwood here. And I think what's going to happen here, in the midst of this inquiry, very quickly, they're going to get lost. And then they're going to have to restructure into a series of questions, hypotheses, if you like, to test. Did masks actually work and make a difference? Did the interventions and policies in care home make a difference? Was it right to not have people going into care homes when their loved ones were dying? Questions is what they should be asking and setting them out. But they will be about a year in when they suddenly go, we are awash in evidence and we're getting lost. Let's rail back and try and bring some
And we're not going to ask those real ones. I mean, there is also just this sort of mass psychosis, isn't there, in terms of not learning the lessons from the control group, which was Sweden. I mean, this is the reality. Indeed, in America, the control group, which was Florida, there was a country that followed pre-pandemic planning to the letter, pretty much. World Health Organization advised, and exactly the same pre-pandemic plan that we had. They were not the outlier in Sweden. They were the one country that stood alone and followed pre-pandemic planning. And I keep hearing people who tell me, yeah, but look how badly they lost so many people to COVID. Yeah, they lost more people to COVID early on. There are various different reasons for that. But in terms of overall excess deaths over the last few years from all causes, which is what matters, and then you get rid of all the issues of how you define a COVID death. At the end of the day, they have lower excess deaths than not just us or Germany or France, but also all of the other Nordic countries as well. Now, that must tell us something, because if we're told that the answer should have been locking down longer or locking down sooner or locking down more, or more masks earlier, or more testing earlier, or whatever it is people are demanding without having any benefit of evidence or fact behind it. How can they not look at Sweden with an honest mind, an open mind, and not conclude that the answer actually was to do what Sweden did, which was to not lock down and not have all these mandates?
Yeah, so what's happening here is people have very polarized views about what was the right course of action. Some of them are driven by emotion, but also some of them are by covering your backside, if you like, because actually I can't show them to be wrong.
Yeah.
Now, the problem with polarized views is if you have 200 people in the room and you just get loads of opinions, basically what's going to happen is you're just going to get these views opposing and you're going to come out with reaffirming your own views.
Yeah.
What you're asking is for them to go and say, look, go and look specifically at some areas like Sweden and look at them as a control group and provide us with the evidence for the inquiry. Now, the question is that should be done by somebody who's independent of the whole structure and system and says, yes, we've looked into it and here's the evidence and here's what it shows compared to what you did. But if it just comes down to opinion, we're going to end up in this problem. 200 people who are all going to give their views, which actually will be saying and supporting lockdown and restriction.
And look, you got stuff wrong during, you're actually an expert in this field. You got stuff wrong during COVID. I certainly did. I'm not an epidemiologist. I have to say, though, when I look at, what the people advising the government got right and wrong, I'm going to say that, you know, I mean, you certainly, and me too, I think I got a better track record than they have in terms of calling things right or wrong, which I find terrifying. But then I can actually read a graph. Not getting everything right, never claimed to. I've changed my mind as I've seen different evidence, and I've definitely got things wrong. But the question is having that open mind and being willing to change your mind on things when the evidence shows that you haven't got things right. Just finally, one thing I want to ask you. Lots of focus, we already see it. I've seen this in the BBC, Sky, Mirror, Guardian. This is the sort of line they go on saying, there's already an outcry and concern that the families of COVID victims aren't getting to have their say. They're not able to be among all those speaking and not necessarily, getting to give evidence. But the reality is that someone whose loved one who died in a care home in their 80s or 90s of COVID, I mean, as sad and awful as that is, what they've got to say is not evidence that is relevant to this pandemic inquiry, surely.
Well, look, we all feel for people who've had someone or a loved one die, and I've seen one and actually been at the death of some people in this pandemic.
You worked in A&E during the pandemic, yeah.
Yeah, and going into homes in urgent care. And there have been stories where I think people have real emotional difficulties with being locked out at the point when somebody died. I think that's an issue that has to be addressed. Is that right to be able to die alone?
Yeah.
Die in a hospital where nobody's let in to give you that support at those last important moments.
Yeah.
So I think that is an important question. But you're right, you could get it overtaken with emotion. And once you do that, then it becomes a problem because you're on that sort of crest of that wave, if you like, saying, well, look, everything that comes next has to support that emotional feeling. So I think what has to happen is they have to have their moment in the day, and then they have to draw back the inquiry and say, look, we're getting down to business. Yeah. This is a court of law approach, unfortunately. Yeah. It is not something we'll make decisions based on emotion, but it's a real problem because it's going to persist right throughout the inquiry.
It is. Carl Hennigan, you've been such a star throughout this. And again, we're just look at the evidence. Let's look at the facts. And if the facts change, we should change our minds. Carl Hennigan, Professor of Evidence-Based Medicine at the University of Oxford. Thank you so much.